Has your pediatric dentist recommended a trip to the orthodontist, but your child hasn't even lost his or her baby teeth yet? Well, here to tell us more why an early trip to the orthodontist might actually be a good idea. We're joined by Charleston Orthodontic Specialists. We've got Dr. Patel and Nicole here. Thank you to both of you for joining us this morning. How are you?
Thank you. Good.
Doing
How are
great.
you?
Good morning.
Good. I'm glad to join you guys over Zoom. You are open though and seeing patients, so we'll start by saying that. You know, this is what happened to my daughter. She was, I think, 7, right? It's the first age that they recommend. And I'll admit, I thought the dentist was crazy. Like, she's so young. She hasn't even lost all her teeth. But we went to you guys and started treatment. So tell me a little bit more about why this is a good idea.
So most people think that we only really straighten teeth, which doesn't seem to make sense if you have baby teeth that are eventually going to fall out. But there are some cases that can benefit from seeing us before a child hits their teens. What this is called is early orthodontics, also known as two-phase orthodontics, when you have ortho treatment when you're a small child, as well as, again, when you become an adult. These can help things like overcrowding, and underbite and overbite and things like this.
Okay, so let's talk more about phase 1. I think you just rattled off a lot of them, but what might a parent expect during that first bit of treatment?
Right, so during phase 1 treatment, there's a chance that we might be putting a few brackets on in order to correct something like an overbite. Other times it's just an appliance to really help with any discrepancies with the jaws. So whether it's trying to help, bring the lower jaw forward or preventing the upper jaw from growing any further. But normally it's either an appliance or a few brackets that kind of help us get in early.
Yeah, my daughter had headgear, which she actually wore. She wore it at night and it did a great job of quickly correcting her overbite. I do see here though that you can even offer Invisalign for kids. Is that true?
Yeah, in fact, Invisalign for kids is a great idea. So you think that, adults only could be an Invisalign, but children are actually more comprehensive with the treatment than adults can be sometimes. And a good thing about it is you can take them out to clean, you can take them out to brush, you can still eat all those fun things that you can't eat with braces. And then we can use some appliances with Invisalign that you can't, necessarily use with braces. So it's a great idea.
Right. I did Invisalign as an adult and I loved it. So I could see why a kid would like it. You just have to be careful they don't throw away those retainers, right?
Oh, yeah.
Exactly.
Can you tell I have children? We know. I've dug through a trash can or two. We know all about that. Let's talk about after the phase 1 is completed. So my daughter did do phase 1 and she's pausing it right now. So I'm very curious about this answer. When do you start round 2? When does that second phase begin, or at what age are they ready?
Right, so normally phase 1 is around 10 to 14 months, and then we'll end up giving a retainer to pretty much retain where the teeth are, everything we did to hold that. And then it could be another year, it could be 2 years, but right around the age of 12 to 14, we'll get that second round called phase 2 of treatment, where we're essentially putting brackets or even Invisalign, correcting alignment of all the teeth, all the adult teeth. And so we want to wait till all the adult teeth are in, and that's when we start phase 2.
Okay, and it is common though. I know sometimes, I think when my daughter first went for phase 1, she wasn't quite ready. So even if you go for that first appointment at 7, sometimes you guys will say like, we're not there yet. Do you see that too?
Yeah, so we like to monitor, obviously from the age of 7 up. You can be seen every 6 to 12 months and we take those x-rays. And with that, we like to, it's a free exam. Regardless, you come in, and if you're not ready, so be it. But when you are ready, we have all those records from, the past to develop and help us with your full treatment.
Right. So many benefits to do this. For someone interested right now, how can they get started with Charleston Orthodontic Specialists, that first consultation?
All right. We do offer free consultation. Just go to our website, www.charlestonorthodonticspecialists.com. You can fill out a little survey or virtual consultation. There's a little blue button on the bottom left. Otherwise, you can call us at 843-4-BRACES.
All right. Dr. Patel, Nicole, always good to see you. You guys have a wonderful day. Thank you so much for your time this morning.
Thank you.
Likewise. Take care.
Bye.